This is Crystal Fenn with MedPage Today here in San Diego at the Society of Thoracic Surgeons meeting, where we heard a discussion of trials comparing coronary artery bypass grafting and percutaneous coronary intervention, particularly the SYNTAX and EXCEL trials. I spoke with Dr. Joseph Sabik of the Cleveland Clinic about the results.
Well, SYNTAX is an amazing study. It's probably the most important study looking at ischemic heart disease, whether patients should be treated with PCI or surgery. And it took a group of patients that are very high risk. They have either left main disease or three-vessel coronary artery disease. They're patients that really benefit from surgical revascularization. And it randomized them to either PCI or surgery. And the primary endpoint was the freedom from death, stroke, MI, or revascularization. And what this study showed, that surgery was overwhelmingly beneficial to patients. In addition, when you broke the study down and looked at subgroups, the patients with three-vessel disease really did much better than the PCI patients in terms of living longer, having fewer MIs, and less revascularization. So very exciting results of the benefits of coronary artery bypass surgery. The results with left main are not so clear. There seems to be, or at least suggestion, that maybe patients with not extensive coronary disease and left main may do as well with PCI. But patients, again, with left main and extensive coronary artery disease do much better with surgery. So again, this study seems to show that surgery is really beneficial in patients with extensive coronary artery disease as opposed to patients having extensive coronary artery stenting.
And then how does the EXCEL trial play into that?
Well, the EXCEL trial is the natural extension of the SYNTAX trial. You know, a good study like SYNTAX tells us where our opportunities are, where do we have to investigate next. And there's that group of left main patients, again, those patients with low coronary artery disease complexity, or what we call a low SYNTAX score. Those patients at least have a suggestion from SYNTAX that they do as well with PCI or surgery. But again, it's just a suggestion. And when you start to get to subgroup analysis, you have to be a little bit careful. What we plan on doing in EXCEL is taking that group of patients with left main disease and not extensive coronary artery disease complexity and randomize them to PCI, to surgery. It's kind of the last part that we need to figure out.
These trials are already having an important impact on the field, according to Sabik.
You know, I think patients, as I think we all would, want to have as less invasive a procedure as possible. One of our responsibilities as physicians is not only to guide them, but also to help them make the right decision. Even if a procedure is less invasive, but we know is less effective, should we be doing that? And I think as a society, we have to make sure that patients understand that, yes, you can get a less invasive procedure, but you may not be alive 3 years because you have that. And so I think this is part of our informed consent. And obviously, whatever procedure a patient has is up to that patient, but it's our responsibility as cardiologists and surgeons to provide them with that information. Should it be, changing percutaneous interventions in patients with non-complex disease? Absolutely not. You know, if you have one or two vessel disease that maybe involves the right or circumflex, absolutely you should have PCI. But if you have extensive coronary artery disease that involves your three vessels or left main and three vessels, we should be making sure those patients are directed towards surgery.
So these trials comparing CABG and PCI may be having an important impact as physicians decide between the two procedures for their patients. Here at the STS meeting in San Diego, I'm Crystal Fenn, MedPage Today.